Intramuscular injection. We're going to be giving Solumedrol 125 milligrams intramuscularly. So you saw the reconstituting video before. I know that I need, based on my dilution of 500 milligrams and 2 mLs, I need 0.5 mLs to get my dose. I have my needle ready, I have my gloves ready, and my alcohol. I'm ready to transition into my patient, so I'll wash my hands, go into the room, introduce myself to my patient, make sure I check 2 patient identifiers with their armband. The next thing I'm going to do is I'm going to make sure that I pick the right site. Now the sites for an intramuscular injection are either the deltoid, the rectus femoris, the vastus lateralis, dorsal gluteal, or ventral gluteal. Now, the size of my needle here is 1.5 inches. This necessitates that I use one of the either leg or gluteal muscles sites. I'm going to choose that I'm going to be using the rectus femoris because it's an injectipad and I can say whatever I'd like. So I'm going to use the rectus femoris. I'm going to alcohol it off, finding the rectus femoris at the hip and the knee. It's the top muscle of the quadricep. I'm going to scrub for 3 to 5 seconds. While that's drying, I'm going to put my gloves on and prepare my needle. An important thing to remember with the intramuscular injection is that once I have the needle in, I need to aspirate prior to injecting to make sure that I'm not in a vessel. So I take the cover off of the needle. Now with the IM injection, instead of tenting or gathering, you're actually going to pull the skin taut because you want to squish down the subcutaneous tissue to make sure that your needle goes right into the muscular layer. So I'm going to pull the skin a little bit taut and firm. It's a 90-degree angle, a very abrupt darting motion all the way in, all the way down. I'm going to bring those 2 fingers in to stabilize. I'm going to aspirate by pulling up just gently enough to make sure I meet resistance. Once I know that I've met resistance, I'm going to switch to giving the injection. Give the medication slowly over 3 to 5 seconds. Once it's completely injected, I switch back. I pull the skin taut again, pull the needle out, perform needle safety immediately, set the needle aside or in the sharps container, check on my patient. Now with this injection, because it is in the muscle layer, if I want to, I could put pressure on it, I could massage it a little bit, put a band-aid over it, because you will not alter absorption. Once I know that my patient's okay, my gloves come off, I wash my hands, and I document the procedure.